is Heart Rhythm TV, and I am Julie Shea here with another episode of Advancing Allies. Today's topic is on recruitment, onboarding, and retaining new EP allied professional staff. As we all know, recruitment and retention of qualified EP allied professional staff is a very complex and time-consuming process. It can actually take upwards of a year to develop an independent EP allied, depending on their job role and previous experience, either clinically and whether they're hospital or practice-based. Much time and effort is involved in this process. So with me here today, I have Aimee Bollentin, who is a nursing practice specialist at Massachusetts General Hospital in Boston. I have Alison Gilmore, who is a DNP and nursing director of the EP lab at Massachusetts General Hospital. And I have Angela Tsiperfal, who is a nurse practitioner and manager of the Stanford Arrhythmia Services and EP Fellowship for Advanced Practice at Stanford Healthcare in California. So welcome, ladies. So glad to have you here this evening.
Thank you.
Thank you for having us.
Yeah, we actually have a bi-coastal representation here today. So very, very excited about that. So let's talk about recruitment first. So Alison, can we talk a little bit about the overview of kind of what are the recruitment challenges?
Yeah, Julie, I think we can all relate to the challenges and the struggles we've had trying to pull ourselves out of COVID. So it's a challenging time for everyone. I think as a leader, we really must be agile and responsive. You know, candidates have choices nowadays. And so I have adopted what I like to say, sort of a fire alarm response. The minute a candidate's profile comes across my computer, everything stops and I immediately peruse the resume and text that person, because timing and being responsive is really key. I think, you know, our mindset has to be that we start with yes. And, you know, it's not, can we make this work, but rather, how do we make this work? And I really think that has been key to our success. You know, when we started, Aimee and I 2 years ago, we actually had a gap of about 9 FTEs in our nursing. Then that's our baseline staffing. Through that time, we've actually added 3 hours of additional operations. And we're actually planning for an expanded EP lab in March of 2023 that will yield 5 rooms total. So we'll be adding 2 rooms. So we have successfully recruited 15 nurses and 7 technologists over the past 2 years. I think that we need to think outside the box. We've actually, you know, ideally we look for intensive care unit nurses, emergency room nurses. We've actually successfully transitioned intermediate care unit nurses. And I think we just need to be creative. We need to look at candidates holistically, and we really need to be timely and creative with our responses. We have a robust interview process where we have folks Zoom interview. We have them come into shadow, which is really key. It allows them to immerse themselves in the clinical environment, which, as we know, being such a specialty, many folks are truly not aware of what we do. And most importantly, during that shadow, it allows them to really talk candidly with members of the team and get a sense of the culture and the climate. And last, we have a staff interview, which I can speak to later, but I really think is the key to our retention, is involving the team in the process as well.
Yeah, I mean, I couldn't agree more. This whole post-COVID landscape, I mean, jobs have become very competitive,
Yes.
You know, more so for the employees, that they have greater options.
Right.
So you really have to make something attractive to them right from the get-go. So Aimee, I'd like to kind of shift over to you next to talk a little bit more about kind of the training challenges involved.
Well, as we've had to think outside the box and recruit folks from other areas, it results in people having diverse backgrounds. And it results in, you know, we need to develop customized educational and clinical orientation programs to meet their needs. Often these folks are coming in, they have little or no cardiology or EP background, so it can be challenging. Some of the other training challenges is having limited onboarding time to get these folks up and running, and to reach that level 1 competency. And then clinical space constraints. You know, we only, 3 procedure rooms. It's challenging to get folks up and running, and when you don't have a lot of space. And as a result, in the end, we have to develop and coordinate these customized programs to meet every person's individual learning needs.
Yeah, absolutely. So moving on to kind of the next topic area, Alison, talking about retention challenges. So you've now invested a lot of time in identifying potential candidates, getting them in, starting to get them trained. How do you keep them there?
Yeah, great question. I sort of think about, when we think about patients, we have to immediately think about discharge at admission. And I think we need to immediately think, how are we going to retain folks the minute we hire them? It needs to be front and center. And I think, as we talked about the post-COVID time we live in, I think, folks have really just taken a step back and really appreciate work-life balance in a way that they maybe never did before. And we as leaders and as folks recruiting, we need to also value that and not just talk about it, but respond to it, act on it, and really be thoughtful about work-life balance. I talked a little bit about all the recruitment we did. During that 2 years, I also had several nurses, almost all of the nurses, voice a desire to decrease their hours and go from 40 hours, 4 days a week, to 36 hours, 3 days a week. And, I'd be lying if I didn't say there was a part of me that was tempted to say, not now, I've got all this recruitment to do. But I needed to think, this is what these folks need. This is going to give them that balance. It gives them another day a week. And you know what? Again, start with yes, right? Yes, we can do this. We'll figure it out and it's going to make a difference. Other ways I think that are, involving the staff in the interview process, really, we try to think of it like we're trying to create this happy, healthy work environment that feels supportive. We're creating a culture, sort of a family, and we really want to be thoughtful about who we bring in and make sure that they're going to support the culture and climate we're trying to create. We circle up, huddle every day, and, some things are inspirational, operational, patient comments, which hopefully validate the care we give every day. And even just as simple as being thoughtful about how often I communicate and reach out to staff. I send one email a week. I want them, when they're there, to really focus on the patients and the care they give. And when they leave, to be able to leave work and rest and recharge and not have any added burden. So I think it's just, all those little things, but being very thoughtful and intentional about respecting and fostering their work-life balance, I think, is key to retention nowadays.
Yeah, no, I couldn't agree more. I mean, you hear a lot of this on the news and other industries, across the board, that work-life balance has become, because now we can work remotely from home, which was never an option before.
Right,
so,
right.
Obviously, a lot of some EP can be done from home, but some can't. So being able to create that work-life balance, I think, is very important to, make sure people are happy, and job satisfaction is so important.
Absolutely.
So, Aimee, can you talk a little bit about kind of customized training solutions, what you do at Mass General to kind of get your staff trained?
I think one of the things that Mass General has done was that they have created this position that I hold, a nursing practice specialist. And my job is really to develop and coordinate the orientation for all these new staff coming in with various backgrounds: nurses, EP technologists, advanced practice providers, nurse practitioners, PAs. It's a huge project to be able to provide them with their orientation to the unit and learn about EP. As you said, Julie, the learning curve on this can be at least a year for some providers to get some level of competency. And we've developed a 3-phase orientation program. It starts with level 1, the first 12 weeks, just getting the folks up and running so that they can function safely and competent in the lab. The level 2 is the next 1 to 2 years, where we're really learning more in depth in EP and really beginning to understand those complex EP processes and getting prepared ready to take their certification exams, be it RCES or the CEPS exams from the IBHRE. And then level 3, EP continue to learn. It's constantly changing. As I say, I learn something new every day. And fostering that learning environment is so important as far as retention, is creating that fulfilling learning environment at work so that you're always, it's just fostering good retention. And level 3, just preparing folks for their certification exams, the RCES and the IBHRE CEPS exams, really fostering a environment of learning and job fulfillment, and that also helps with retention. They come in level 1 and we do a learning assessment on them to really see where they're at and develop a customized orientation program that includes didactic, hands-on simulation, and also clinical training. We also do competency assessments throughout the orientation to monitor progress, identify any gaps that they may have, and adjust the orientation to fill any gaps to ensure timely completion of that level 1 competencies.
Yeah, I mean, I think that's great. The creation of a job like yours, that is specific focus is to onboard people and to help with that retention process and the ongoing education. I mean, all of this leads to good patient outcomes, right? That, if staff are well trained, they're happy, that our patients are going to be well taken care of. So thank you so much for that, Aimee. And I'd like to bring Angela in on the conversation now. Angela, actually at Stanford, they have a very unique training program there. It's actually an allied professional training fellowship. So Angela, could you tell us a little bit more about the program, this unique program that you have at Stanford?
Of course. So advanced practice provider in electrophysiology at Stanford Healthcare function very autonomously and are critical to the success of the expanding electrophysiology service. We struggle finding competent candidates, just like everyone else mentioned here, and the recruitment process usually takes months. Candidates we do find are often inexperienced in EP, so training can be lengthy and it takes up to 12 to 16 months before the provider can function independently. Stanford Healthcare has an established accredited APP fellowship program with specialty in cardiothoracic surgery, cancer care, and administration that is transitioned to practice program with a structured national recruitment process. In 2020, after a competitive application process, EP was the selected specialty to join the Stanford APP fellowship program. Stanford APP Fellowship in Electrophysiology is the first in the country to provide an opportunity for the new APP to gain in-depth exposure to the comprehensive care provided to patients with cardiac arrhythmias. This is a 12-month fellowship program, provides novice APP with practice-based learning, education, and mentorship in the domains of professionalism, role integration, and specialty competencies. The program integrates 500 structured didactic hours and over 1,200 clinical immersion hours, utilizing a variety of independent and group learning methods like self-learning modules, simulations, interdisciplinary rounds, journal clubs, and process improvement projects. The design curriculum was based on 2020 ACC clinical competencies for nurse practitioners and physician assistants in adult cardiovascular medicine and the 2021 FHRS educational framework for clinical cardiac electrophysiology. Fellows go through 6 weeks clinical rotations focused on inpatient, outpatient management, cardioversion, device management, and electrophysiology laboratory, as well as brief rotations in other subspecialties like general cardiology, interventional cardiology, heart failure, et cetera. In EP-APP fellowship program, the EP fellowship program is under the umbrella of Stanford Center for Advanced Practice in collaboration with the Center for Education and Professional Development. We accept 1 to 3 fellows per year in select specialty areas. Potential candidates are reviewed and selected by an application and interview process. We received 13 applications in our first year of fellowship and 15 the following year. 2 APPs competent in EP graduated from our fellowship in October of last year and accepted a permanent hire position. Orientation was less than 4 weeks compared to the usual 12 to 16 months. And we're currently in the process of training our second cohort of fellows.
That's great. How many do you have onboarding right now?
Two.
Okay. I mean, it's what an awesome program to get people, and obviously they're getting paid throughout their fellowship.
That is correct.
They're active employees and tremendous. Well, thank you all for participating in our program today. And you provided us with some great information about, recruiting people and onboarding them and being able to retain them, as well as hearing about kind of a novel fellowship program for allied professionals. And, certainly these provide the framework for future programs that other institutions can use to develop these processes kind of in this new environment in which we're living, right? So if we think about it, it does require obviously active engagement with the employees from day one, as Alison alluded to. We got to get on this because it is a competitive environment. It's a situation which is fluid and evolving over time. And obviously the work-life balance really after COVID has changed the landscape of how we recruit and retain employees. So thank you all for joining me here this evening for our program. For more information, certainly you can check things out on our YouTube channel. And this is Julie Shea for Heart Rhythm TV.